When is mechanical thrombectomy used for stroke patients? Imagine a stroke happening when a blood clot blocks a major artery in the brain, cutting off blood flow and risking serious damage. Mechanical thrombectomy is a powerful tool used to remove these clots and restore blood flow quickly. It is mainly used for a type of stroke called an acute ischemic stroke caused by a large vessel occlusion, especially in the front part of the brain. These blockages often involve large arteries like the internal carotid artery or the middle cerebral artery, close to the brain's surface. Doctors usually consider mechanical thrombectomy when the stroke symptoms are moderate to severe, often indicated by a score of 6 or higher on the National Institutes of Health stroke scale. The goal is to act fast because the best results happen when treatment is done within 6 hours of symptom onset. However, recent studies have shown that some patients can still benefit up to 24 hours after symptoms start, if imaging scans show that brain tissue is still salvageable. Imaging tests like a non-contrast CORT scan or advanced perfusion imaging are crucial. They help doctors see if there is a small core of dead tissue and a larger area of at-risk but still recoverable tissue, called the penumbra. If the imaging shows a favorable mismatch, the patient may be a good candidate for thrombectomy even if more than 6 hours have passed. Other factors include the patient's pre-stroke health and functional status. Those with minimal disability before the stroke tend to do better after the procedure. Age alone is not a strict barrier. Even older patients over 80 can be candidates if they meet other criteria. Patients with very mild symptoms or large infarcted areas are still being studied to understand if they benefit from thrombectomy. The procedure involves threading a tiny device through blood vessels to reach the clot, then removing it using a stent retriever or aspiration device. It is often performed alongside clot-busting drugs called intravenous thrombolytics, but imaging to confirm the clot should not delay giving these medications if needed. Landmark clinical trials have shown that thrombectomy can significantly improve recovery and reduce disability when done within the appropriate time window and with the right imaging findings. While ongoing research continues to explore extending the window and treating different types of strokes, current guidelines recommend mechanical thrombectomy mainly for patients with large vessel blockages in the front part of the brain, moderate to severe symptoms, and evidence of salvageable tissue within 24 hours of stroke onset. In summary, mechanical thrombectomy is a crucial treatment option for certain stroke patients with large artery blockages in the front part of the brain. It is most effective when performed quickly, ideally within 6 hours, but can be beneficial up to 24 hours in carefully selected cases based on advanced imaging. Always remember, each patient is unique, and treatment decisions should be made by healthcare professionals based on individual circumstances. If you or someone you know experiences stroke symptoms, seeking emergency medical care immediately is essential for the best possible outcome.